Hey everybody, this is Josh back with Fight Bad Medicine. Today I want to talk to you about how obesity, high blood pressure, and diabetes, these chronic diseases, should be the concentration when we're trying to fight CV-19 now. The concentration should not necessarily be on the lockdowns, which can have really harsh effects on people's health in addition to just being inconveniencing. I want to talk to you about this article from the NIH, from National Institute of Health. So they talk about this study of 5,000 patients within New York. They were admitted for CV-19. There's 12 hospitals in New York City, Long Island, Westchester County between March 1st and April 4th. And they found that 80% of patients had at least one underlying medical condition, one or more. And the most common underlying health conditions in the patients that were admitted for CV-19 were high blood pressure, that was affecting 57% of all patients, obesity, 42% of all patients, and diabetes, affecting 34% of patients. And then in other studies, we've actually seen that not only the hospitalizations, but the death rate really shoots up. We're talking about 94%. They found that 94% of people that ended up dying from CV-19 had one or more underlying health conditions such as high blood pressure, obesity, or diabetes. These should be the main concentrations. So the funny thing is that we are concentrating on locking people down when, let's say government wanted to take over something. What should they do? Get the soda off the shelves, get the alcohol off the shelves. You're gonna take away liver disease, you're gonna take away high blood pressure, you're gonna take away diabetes, you're gonna take away all these things. Now, I don't believe in taking away people's rights. I believe that people should have the freedom to choose what they want to eat, what they want to drink, and that's okay. But if that's going to be the standard, if you're not going to take away those things, then you can't lock people down, because the more important thing would be to concentrate on the chronic health conditions. Am I right, or am I wrong? So, and then when you look at the lockdown itself, more people are actually dying from the lockdown itself than from CV-19. We're talking about people dying from suicide rates going up, domestic violence going up, alcohol and drug abuse going up. So the funny thing is that those things which actually make you more vulnerable to being hospitalized for CV-19 with alcohol and drug abuse, those are actually going up. So they're just feeding the condition. They're just pouring fuel into the fire. And then I also want to talk about the idea that CV-19 is going to be around forever. I mean, for the rest of our lives and for the next generation, it's just going to be in a different form. It's going to be in a different strain. We know that the Spanish flu since 1918 has been around. We think that, okay, so it happened, tens of millions of people died from the Spanish flu and it was over. No, we have a strain of the Spanish flu every single year, just a different form of the Spanish flu. But have we locked people down since 1918? That hasn't happened. The idea is that we have to really concentrate, and we shouldn't necessarily take the soda off the shelves or alcohol off the shelves, but we should make people aware of these things. So the idea is when Dr. Fauci gets onto TV and starts talking about how we can get out of this situation by finding a vaccine, by finding a treatment, by locking ourselves indoors so we don't see the light of day, how we have to stay 16 feet apart from each other. I'm exaggerating, obviously. But the idea is that should not be the focus. He should be getting on TV every day and telling people, stop drinking alcohol, stop eating potato chips, stop drinking soda, right? These are the things that are leading to the hospitalizations. Yes, we come in contact with CV-19 every day. I mean, we're talking about they're estimating in some of these large cities like New York City that 30 or 40% of people actually have CV-19 already. Not everybody's dying. Not everybody's being hospitalized. the people that are the most vulnerable are the people with chronic health conditions. The focus is really on the old age homes and people that are older, but it's really, the idea is not so much the age, which age is definitely a factor, but is that these people have numerous health conditions. These people, the elderly, the nursing homes are taking sometimes 10 or 15 medications for the chronic health conditions, which the medications can actually make things worse, but that's for a different day. But the idea is that the focus really needs to be on the diet and lifestyle. Actually, if you end the lockdown and people get outside, people get more vitamin D, they get fresh air, they get exercise, they're in a better mood, and that really helps with overall health. You sleep better. When you're exposed to sun, you actually sleep better. And social interaction is very important. All these things are extremely, extremely important. People are not eating as well. People are eating the purchase of junk food has skyrocketed because people are stuck at home. They're not eating well. All these factors are just amplified by being locked down. So it's not that it's not important to maintain good hygiene and to wash your hands and to cover your face when you sneeze with your elbow and to maybe even wear a mask. The problem is that there is not enough focus on diet and lifestyle, which are the main driving factors why people are getting so sick. So I believe after all is said and done, we are going to look back and see why our mortality rate was so high, why our hospitalization rate was so high, was directly related to the outbreak, the epidemic of obesity in this country, the epidemic of heart disease, high blood pressure, diabetes. It's not necessarily that it was New York City and New Jersey that everybody was one on top of the other. That wasn't the main driving factor. I believe that when they control for all the factors, when they compare our country to Europe, to Asia, they're actually going to see that the reason our rates of mortality and hospitalization were so high was because of our epidemic of chronic disease. So the idea is that we need to make people aware of this epidemic. And we as individuals can take matters into our own hands. We don't have to wait for the government to give us guidelines for these things. We already know them. We can tell the next person the same thing and we can pass it on. And that's how the word spreads. That's how we beat this epidemic. Not necessarily through masks and social distancing. The main driver is really focusing on the foundational health of this country. The foundation meaning diet and lifestyle, eating a plant-based diet, getting exercise, getting outside, socializing, sleeping at the right time. Those are the things that are going to end this epidemic because they're going to end the underlying factors of obesity and high blood pressure and diabetes. So if you really want to learn more about these things, you can definitely search our channel, but there's so many great doctors out there that are talking about this. Neil Barnard is a great guy. Michael Greger is a great resource. Excellent resources. Or you could just tap into our channel, Fight Bad Medicine. We talk a lot about the benefits of a plant-based diet and how you can end these chronic diseases. If you want even more information, you can go to our website. It's arkwellnesscenter.com, arkwellnesscenter.com. And so if you like this video, please share it with everybody else because that's how we're really going to end this epidemic. And just share the word of good health with everybody else. And that's how you're going to do your part and get this country back on track. Thank you so much for listening, and like and subscribe. Take care, guys.